activities. HIV can be transmitted through sexual activities with an infected person. That is, when a non-infected person has sexual relations or engages in sexual activities with an infected person, then there is high probability for the non-infected person to contact the virus through the sexual activities. Another way is blood transfusion. Blood transfusion. If the blood of an infected person is transferred to another sick patient, then the virus will be transmitted. This simply means when an HIV patient, if the blood of that patient is drawn out and transfused to another sick patient without HIV, then the other patient will contact the virus because HIV is in the blood. Through unsterilized medical utensils. The medical utensils used in a hospital must be sterilized to avoid transfer of disease or infection. Not only HIV, other diseases and infections. If a needle used for an HIV patient is used for another patient, then the patient will contact the virus. If the medical personnel in charge of the utensils is not careful and mistakenly pricks him or herself with this unsterilized utensils, the medical personnel is also prone to contacting this virus. Then lastly on my list, the careless handling of an infected blood by medical experts. If medical experts handle blood of infected individuals that have been infected with HIV, when they handle their bloods carelessly, without proper routine, then HIV virus can be transmitted to every other person. The next question to ask is, what are the symptoms of HIV and AIDS? Many people who are living with HIV have no obvious signs and symptoms at all. Recent evidence shows that between 70 to 90% of people who become infected with HIV experience flu-like symptoms within a few weeks after the infection. The most common symptoms are fever, rash, severe sore throats, all occurring at the same time. These symptoms in an otherwise healthy person may indicate recent HIV infection. Then, if an individual should notice these symptoms, what is the next step? An HIV test. What is an HIV test? An HIV test checks your blood for antibodies and antigens to HIV. When HIV enters your body, your immune system tries to fight. It tries to fight off the infection by producing antibodies to the virus. So, what does the test involve? An HIV test usually involves taking a sample of blood and sending it to a laboratory to be tested. This simply means that for an individual to detect whether he has HIV or not, the person has to be tested for HIV. And the routine of this test is the antigens of one's body produced after infection with HIV reveals to the medical practitioners that such person has just been infected with HIV. because the immune system tries to produce antigens that would fight off the virus. An HIV test is mostly done with the blood. That is the blood sample that is sent to the laboratory to be tested for the HIV virus antigens. Then someone will ask, what is the treatment for HIV? Once HIV is diagnosed, you will be given a number of tests to monitor. These tests are to monitor the stages of the infection and to show if or when the treatment should be started. People with HIV may be supported and treated by their own doctor or by a specialist at an HIV clinic. Services may work together to provide specialist care and support. At the moment, there is no cure for HIV or the last stage of HIV infection. But there are drugs known as antiretroviral treatments, ART, or combination therapy that reduces the level of HIV in the blood and prevents or delay the development of late-stage HIV infection, which is AIDS. Most people with HIV benefit from these treatments and live longer and have better health than if they had not taken the drugs. Preventive measures against HIV and AIDS. Abstinence from any sexual activity. That is the first preventive measures against HIV and AIDS. And this means steering clear from any activity that is sexual. Another preventive measure is use of clean and sterile needles. This applies to individuals and clinics. The needles we are to use, either for individual purpose or for clinic purpose, should be clean and sterile to prevent the contaminants of HIV. Do not share any sharp objects like hair, clipper, razor, and so on. When an individual endeavors to stay clear of sharing sharp objects with other persons, even if you don't know their status, whether positive or negative, it prevents the spread of HIV and AIDS. Having one partner and being faithful to that partner also prevents HIV and AIDS. This means, as an individual, if you are to have a sexual partner, then make it one and be faithful to that one partner, because this will prevent HIV and AIDS spreading in our society. Use of protection like condoms during sexual activities also help in preventing HIV and AIDS. Although it should be noted that this measure is not 100% protective, but in most cases it has helped at reducing the level of risk that people are open to when they are engaged in sexual activities. The last on my list is being careful with HIV-infected blood in the clinics. This implies that clinical experts, medical practitioners, nurses, doctors, scientists should all be careful in the handling and management of an HIV-infected blood, because failure to do this can result in the widespread of HIV and AIDS. The next thing in line is stigmatization against HIV and AIDS carriers. Stigmatization of HIV carriers means discrimination against them or annihilating them from normal activities. It can be in form of 1. Not sitting beside them. Sitting beside an HIV patient doesn't mean you get the virus. Another thing is not attending well to them at the clinic. The clinic should be a place of succor and refuge for these HIV carriers. But it is little wonder that even when they get to these clinics, the medical experts and the medical officials there treat them even with stigma. And this is not appropriate. They are there in the hospital to be treated and not to be stigmatized. Not talking to them. That is another form of stigmatization. Talking to an HIV patient doesn't mean the other person will contact the HIV virus. Not talking to them would actually break their hearts. And this leads to low self-esteem in most of the patients. Another point is sacking them from jobs. HIV patients